So yesterday, if you heard it, or today earlier, we played it just after 3 o'clock. We spoke to a woman who we identified as Alex because she wanted to remain anonymous. She came here from Europe several years ago. She was a GP, a general practitioner there. Came to Quebec with others at the time and ended up working in hospitals during the pandemic. Thank God for that. We referred to them, the premier, you remember, referred to them as guardian angels. So she worked under contract for 3 years and then was told at the end of it all that the government would offer her a full-time job. Well, the government has chosen to renege on that promise. She told the story of how even after her contract was over and there was a job posting for a full-time employee and she applied, she was suddenly told there was no budget for a job that had been actually posted. So when we spoke yesterday, I was kind of in disbelief to hear that something like that would have happened. And at one point I asked her, look, the situation in Quebec right now is so dire in terms of GPs, over 1 million people on a waiting list. Would she consider working anywhere? Because part of the issue now is, of course, if you're graduating, the government forces you to perhaps get a job somewhere other than Montreal. She said this.
I would like to work as a midwife in the health system because we are doctors, we are educated, we have a lot of experience, but the government or the health system, they don't appreciate us. This is just unfair.
It is unfair. It's unexplainable too, I think. And by the way, I should point out when she says we, from what I understood in that interview, there's at least possibly up to 60 people who find themselves in the exact same situation. Came here, worked in the system during healthcare when we needed them, and now have been left cut loose and said, good luck, but you're not going to get a job here. So that said, I wanted to find out what was going on here. I'd heard of stories like this anecdotally, but here's someone who actually went through it. I said, let's reach out. Andre Fortin is the Liberal MNA. He is their official opposition health critic, and we wanted him to weigh in on this. Andre, thank you for taking the time this afternoon.
Good afternoon.
We sent you the interview. You've had a chance to listen to the whole thing. So I guess the first thing I would ask is, what's your reaction to this?
I think the word you just used, unexplainable, is probably the right one. I mean, you and me and people who work in the media or work in government hear all sorts of appalling stories from government, but this one really takes first step on the podium. I mean, to promise somebody at a time where every country in the world is desperate for healthcare professionals, to promise them, if you work here during the pandemic, we'll give you a full-time job after it's all over, and to renege on that promise for no obvious reason. I mean, this person and all of her colleagues were good enough to work under contract, but not good enough to give a full-time position. That's absolutely unexplainable. There are so many people waiting for a family doctor right now, people who don't know where to turn, who end up paying hundreds and hundreds of dollars to go to a private clinic or who don't get any health care at all. And we're turning away people for budgetary reasons. It sounds like a made-up excuse to me.
So we can all be appalled, and yes, we can try to understand how this happened. The question then becomes, where do we go from here in a case like this?
Well, in my case, I've got a message for Christian Dubé. He can't really expect to get out of the next week or two in Quebec City without answering this question. It will come from us. We will ask him the question. So he has a revue de presse. He gets his press clippings like everybody else in Quebec City. And when he reads them tomorrow, I certainly hope he gets ready for the question, because there is no good answer. There is no good reason for this. So if he has one, we'll be looking forward to hearing it.
Have you seen or heard, you mentioned we hear stories, appalling stories all the time. Had you actually seen or heard something like this story before?
No, because there's so many different aspects of this story that don't make sense. The no budget for doctors after a position was posted, that's saying one thing and the other. The fact that these doctors are good enough to work under contract, but not good enough to get a full-time position. The fact that we promised these guys something at a time where they had all the leverage in the world, and then turned our back on it when citizen services are in such dire needs. Nothing makes sense in this story. So it is probably one of the most jaw-dropping stories I've heard in a long time.
You know, it's funny because I had mentioned in the past an experience I had. So personally, right, I was going to McGill one day, going to the stadium there, and at the top there's a parking lot next to what was the Royal Vic. And the gentleman in the booth, the parking lot attendant, we just started chatting. Turns out he was from Russia. He had been a doctor back there, finds himself in the exact same sort of the same situation, because he couldn't get, despite having the credentials, he couldn't get a job in the system here. And to be fair, that idea, right, never mind the pandemic and working in the system being promised a job, but that whole idea that you could come here from another jurisdiction, have, the correct credentials, which would be accredited here, they'd be okay to work, and still can't find work. I don't understand. Why is that the case?
Well, it's bad enough that we don't recognize credentials, and government hasn't been. And we're not the only jurisdiction in the world that has this problem. There are other provinces, and in the U.S. it's much the same, but there are a lot of doctors who get trained in their countries, and we simply don't recognize their diplomas. But where I think a lot of people are at a loss with these things is when you get doctors who are trained in Europe. This doctor that you interviewed yesterday wasn't trained in some third world country. It's not Dr. Nick from The Simpsons. These are qualified doctors that we've accepted, that we probably have government employees going to their native countries to woo doctors from there. And we have this doctor who lives here, and we can't even properly recognize her. Well, it's not even a question of recognizing credentials because she's already working as a doctor. It's a question of finding her a full-time employment. And I can understand sometimes, I think a lot of people can understand that we want to make sure that foreign diplomas are equivalent to what we have here in terms of training. But in this case, where you have somebody already working here, it just doesn't make any sense. All
right, look, we're going to run out of time. I appreciate that this will come up in the National Assembly. I'd love to find out how it plays out. So if you could let us know, or if we can get back in touch with you, that'd be great.
Absolutely.
I would ask one other question, which has to do with healthcare. Gabriel Nadeau-Dubois was on air this morning with Elias, and he's going on about private healthcare, and not the fact, and I know this is one of those discussions you could have forever, private, public, etc., but his contention is that now we've reached a point where it has become so easy for someone to simply set up a business, a company, offer private health care, that we need to put the brakes on this. It's happening too often. There are too many people doing it, and ultimately it hurts the public system because it pulls people from there. What do you think of that suggestion or that idea?
I heard the interview with Gabriel this morning, and I think one of the things that he mentions, which is correct, is that if you go on the government websites and you are hoping to find a public clinic, you will be directed to maybe public clinics and obviously private clinics. We can debate back and forth as to whether that's a good thing or a bad thing. The problem comes from the fact that there, a lot of the times, and it's true in my region, I'm sure it's true in Montreal, all it will offer you is private clinics. You will not even be offered a spot at a public clinic. So have we gone too far? Has the government accepted too many private clinics? Maybe, because it is becoming harder and harder and harder to find a spot at a public healthcare paid for by the state clinic. And I think that's the real crux of the problem here. It's not necessarily, is it private, is it public? It's the fact that people can't even think of getting a spot at a public clinic anymore.
Yeah, and of course, what we find out is, despite promises from the government or for Christian Dubé that the backlog of surgeries, this procedure that you'd want to have done in the public system is going to get better, it's not gotten better, it's gotten worse.
The only reason Christian Dubé can say that there are less people waiting on the wait list for surgeries is because there's more people on the wait list for consultations. People can't even get in to see their specialist doctors who will eventually tell them they need a surgery. So maybe there are less people who are waiting on one list, but it's just because they're waiting on the other list before, and their problem's getting worse and worse anyway.
And do you think this reorganization of the healthcare system is actually going to make any kind of a positive change?
No, because it's taking decisions further and further away from the ground floor, from healthcare professionals themselves. And they all came to committee before Bill 15 and told us, if you want to get healthcare professionals more involved in the system, don't take decisions away from them. Give them more leeway, more power. There's only so much centralization that you can do. And I think we've already reached that point in Quebec.
And the government is doing exactly the opposite of what they recommend to be done.
And they call it decentralization, yet they're the only people who call it decentralization. Nobody who works in the healthcare system views this reform that way. So it probably would be wise for government to listen to its healthcare professionals.